Hey, we're here with Michael, who's very happy after treatment for keratoconus. A lot of people think there's no treatment. It's not true. We just wanted to go over his history a little bit and show the people out there is things that can be done. It's a little shame that we made him amazing, but then there are all these people, including apparently two people you work with, who have keratoconus, or they're too afraid to come in, or what's going on there, Michael?
Hey, I've told them about. Came up to me saying they had keratoconus after I told them I had LASIK, and I said I was diagnosed with the same condition.
Yeah, and then I guess you and I met like in 7 years ago, and then I think that's before we were doing cross-linking, and then we just told you to hold out and keep seeing us, and you were persistent. I guess you're kind of a persistent guy.
Well, I also tried to get the hybrid lenses, other treatments going. I asked about Intacs.
All right, yeah, a lot of people do hybrid lenses, which if they fit are okay, but they're kind of a little bit hard to get a fit. I think you said you tried for a long time to get a fit on that.
And when it finally got fit, it started fogging up inside the lens. Took it out
Yeah,
right away.
yeah, because there's a little vault, so that sometimes happens, and it's kind of expensive. Did you have to pay a lot for the hybrid lens, or?
I had to pay a lot to go see the ophthalmologist.
Yeah, and then Intacs is a solution that I used to do years ago, like 20 years ago, when it was the only solution that we had. I would say it works pretty well for people who have only astigmatism, although most people with keratoconus also have myopia. It doesn't really help that much with that. And then why did you decide not to do Intacs?
I asked about it, and everybody was dodging the question.
Yeah, so they weren't highly recommending it for you.
Yep.
Okay, so we did your treatment in two stages, really because of the timing. Because when we first met, we were just doing cross-linking. We were not doing cross-linking plus the laser. So I guess you had which eye cross-link first again?
The right eye.
Yeah, and then we had your left eye cross-link. And then I keep telling the people with keratoconus who come in for cross-linking, just cross-linking is going to stabilize the cornea, make it stronger, prevent you from progressing to need a corneal transplant, which is positive, but it only removes about 1 diopter of myopia and 1 diopter of astigmatism with the flattening. And most keratoconics have way more than 1 diopter of myopia and 1 more diopter of astigmatism, so they don't notice that much visual improvement. Sometimes they notice subjective visual improvement, so instead of seeing like triple, they see double or something. So what was your experience visually after just the cross-linking?
After just the
After
cross-linking,
just the cross-linking?
there was a slight improvement in my eyesight,
Yeah,
but I definitely still needed glasses.
right.
I needed to have the restriction put on my license saying I needed glasses
Right.
to drive.
So it was like nothing to write home about.
Basically, it was an improvement, but you said at the time that it was just a side effect of the surgery. The goal of that was to get the corneas stabilized.
Yeah, 100%. Crossing is really just to stabilize the corneas and strengthen them, so you don't need a transplant. It's not a visual procedure, although there is a little bit of, like you said, a side effect, a benefit. So then, I guess then we decided to do, actually we did your cross-linking actually under IRB, so we did it pre-FDA approval. It just got approved 2 years ago, and we did your cross-linking a long time ago. So what was your experience in terms of, I mean, it's not relevant now because it's FDA approved, but back then when we were doing it under investigational exemption with the FDA, what was your experience like, and why did you decide to proceed?
Well, it was either go legally blind with the cross-linking or eventually go legally blind without it and not drive at all. And for the cross-linking itself, people were always saying, oh, the LASIK might hurt, I'm worried about the pain. You saw for yourself that I didn't even know the laser was on until you said it was on.
Yeah, okay. We're because we're doing like 1,000 cases of
The
LASIK.
cross-linking hurt worse.
Yeah, cross-link is a bigger procedure, but because we're doing like 1,000 cases of LASIK per year, where we take off the epithelium, we're very good at taking it off and having it grow back quickly. That's why we're also doing the cross-linking epithelium off, which is really more effective. There are about half of the doctors are doing epithelium on because they're worried that they can't get the epithelium to grow back quick enough, and sometimes it's uncomfortable, causes pain and scarring. That really has to do with the experience of the doctor dealing with the epithelium. So I really think that everybody should just learn how to deal with the epithelium, surgeon-wise I mean, and then do epithelium off, because that form of cross-linking does work better. So so then I guess we decided to do the a laser, and that's also it's also basically off-label. Basically, FDA has not yet approved laser plus cross-linking. We've been doing it now for about 3 years. And then, what gave you the confidence to proceed with our procedures, even though we told you that some of these things were off-label and not yet FDA approved?
Like I said, it was either eventually go legally blind and not ever drive again, or take the risk of losing my eye, and the payoff would be, at the best, have my eyeballs stabilized.
Yeah, I mean, people like the stability, but they're not really looking for that. They're looking for some functional visual benefit. So, I've done a bunch of cross-linking with and without laser, and clearly the people with the laser are happy. The people without the laser, just the cross-linking, on some intellectual level, they're glad that they're not going to progress to transplant, which is a big deal, more than we could do 10 years ago. But they're not jumping up and down for joy, because functionally they're basically seeing the same, which is not very well because of huge amounts of astigmatism. So then we decided to cross-link your previous to laser your previous cross-linked left eye. And how are you seeing now?
On my best days, I can see clear as day.
Yeah, on your best days, we've actually got you as 20/20 uncorrected. It's crazy.
That was just last month.
It's crazy, you know what I'm saying? And on your bad days, you're something like 20/25, which is crazy good anyway. Yeah, if anybody thought, let's say it took you to 100 ophthalmologists before we all started anything, showed you the keratoconic map, which was horrible. I think we could actually show this map. You had some bad keratoconus, baby. So you're okay if we show them?
Yeah, the bulge was like down at the bottom of my right eye.
Yeah, I mean, you had such a bad scan that you had such bad keratoconus that you could actually see it on the microscope bulging out. And I just looked at you today, and actually on your left eye that we did the crossing and the laser, on the slit lamp, the little microscope you stick your head in, we look at you, look at your eye, it looks pretty normal. And on the right eye, it's still bulging out. So basically it means that we changed the shape of your left eye and made it into a normal eye with the laser. So now that you're like 20/20 on a bad day, and 20/25 on a bad day in the left eye, uncorrected, and 20/20 on a good day, what has that meant for your life and your visual function?
Well, I can drive without glasses again.
Yeah, I mean, that's big, you know what I'm saying? And then did it help your confidence a little bit? 'Cause some people with chronic disease, they're like, nothing can be done. They just get bummed out about the keratoconus.
A little bit.
Yeah, I mean, you're a pretty persistent, confident guy anyway. So the purpose of this video basically is to encourage people like your friends at work to not give up, not listen to their eye doctor. Half of the time their eye doctor is like an optometrist or maybe a ophthalmologist who didn't do a cornea fellowship. The only person you should listen to if you have keratoconus is a doctor who did a full cornea refractive fellowship 1 to 2 years after residency that was sanctioned by the San Francisco Match program. There's only about 10 programs in the country, which means there's only about 20 doctors per year being credentialed in terms of a cornea fellowship in the country, right? So if you think about it, in 5 years, that's only 100 doctors. And meanwhile, there are like 30,000 eye doctors out there. So you can understand it's really only 1% of the eye doctors that the keratoconic patients should see. So what's your final suggestion for your friends at work or the YouTube viewers with keratoconus in terms of, not giving up and getting a second opinion, that kind of stuff?
Get checked out. Worst the doctor is going to say is, we don't have the equipment to do this.
Yeah, then you'll be in the same place as before. And I guess the best case scenario, if you see a good cornea specialist, they'll say, hey, CrossLink got approved now. And some of them, probably 1 in 10 of the cornea doctors are going to be doing cross-linking plus laser. We're kind of ahead of the curve here at Park Avenue LASEK. And if anyone has any questions, you could just contact us at Park Avenue LASEK, LASEK.com. You could also email me directly, dr@park, like a park, avenue spelled out, avenue, LASEK, LASEK.com. So thanks a lot for participating. This is kind of like a public service announcement. We're looking forward to doing your right eye, I guess, sometime next year. And thank you very much for participating.
Thank you.
Bye.